Hey guys, I'm checking in a little after 6 weeks post-patellar tendon repair. So I just wanted to kind of give you an update, a really quick update. I don't have like a ton of stuff to talk about today. So it's been a little after 6 weeks, as I just said. I went to my surgeon for the 6 weeks post-op appointment. It did go very well. Essentially, she said I can ditch the brace as soon as I feel comfortable doing it. So needless to say, that went out the window right away, the second that I could. I will say that, I feel really good. I spent a few minutes kind of relearning how to walk with her. It's weird, once you're out of the brace, you kind of realize, I haven't really walked normally in so long, without something on your leg, or without crutches, or even after the injury but before the surgery. So it does feel very weird trying to walk without anything on again. I will say that now I feel like I'm walking pretty well. I'm walking without a limp. I can bend my leg when I walk and everything, but like the mechanics are still like a little weird to me. I have to remember exactly, like, okay, bend your knee, straighten your leg, bend your knee, straighten it. So it's still, my gait is still coming along. That's why it's called gait training, I guess. They have to help you. You have to relearn how to train your body to walk again. So that's like kind of a weird thing. I never thought about before surgery, but that's definitely something that you will need to you'll need to do. Other than that, I go back to see my surgeon in another 3 weeks. She just wants to kind of see how my flexion is going. She did mention that sometimes a second surgery is needed, where they kind of just put you under and then, bend the knee for you. And that happens around the 3-month mark, if, let's say, your flexion isn't kind of where it should be, or if you're not progressing a little bit. She said that probably won't be a problem with me. Like, I'm over 90 degrees flexion, but she did mention it's always a possibility. So hope not. I don't think that's going to be something I need to do, but you never know. In PT, I have been telling them to ramp up the aggressiveness now that I'm, past kind of the safe zone of the 6-week mark. I have been doing a lot more in PT with my therapist, who's also a doctor. Some of the things we've been doing, I've been, in the table or chair, whatever you want to call it, laying down. My leg kind of bent and in the air. He's been leaning on me, and I push him away with my foot. So it's almost like a leg press, a very light leg press. Other strengthening things, like he'll push on one side of my leg or my foot or my knee, and I have to push back the other direction. So it's a lot of just kind of strengthening the leg in all different directions. There's also the fact that he bends it. We keep trying to get a little more flexion every single time. Today actually was what they call, I guess, a test day. So I'm so new to all this PT stuff. This is kind of the first time I think I've ever actually had to do anything like this. But in order for the, I guess, insurance company to decide whether they're going to grant you more sessions or whatever, if they want to keep paying for your PT sessions, the clinic has to kind of document, okay, this is the progress, this is day 1, and this is, the 12th session, and this is kind of where the progress that this patient has made. So today I did a couple different random things with flexion, and questioning me about my pain levels and if they've gone up and down. So it's just, it's interesting to kind of see the insurance world work. So I didn't work with my normal therapist today, but it was good. I also have started doing other kind of dynamic exercises in PT, like I did work on the Bosu ball. So if you don't know what a Bosu ball is, most of you probably already do, but it's kind of like a flat, it's like a round circular kind of plank with like portion of a yoga ball on it. It's inflated, portion of the yoga ball is inflated, and it's really good for strengthening, balance, coordination, all that kind of stuff. A lot of fitness classes use them, and personal trainers and whatnot. So I did some stuff on that. I stood on the ball part, did quarter squats, maybe third of a squat. I did that a few sets. Very, very challenging. I'll say at first I was like terrified that I was like gonna either slip or like squat too deep, and it always still feels like tendon's just gonna burst again. But I've been assured that's not a very likely possibility, so that's good. And then after that, I did some kind of calf raises, and going back the complete opposite direction. So on the ball, that's actually much more difficult than you would think. So I did that stuff with good form. Got a lot easier as I did more reps. And then I also finished on a kind of sitting down elliptical machine, I would say, where I'm sitting down and then the elliptical leg, the part where you put your feet are in front of you and you kind of just do that. Did that for 5 minutes. It was really good to be doing something like that, some exercising that I can move my leg in. I've been told I'm probably about a week to 2 weeks away from being able to ride a bike. So that'll be exciting when I have the opportunity to do that. I am looking forward to it. My flexion's pretty good. It's between 95 and 100 degrees or so. So I'm hoping I can get, to 110, 120 in the coming week or two. I think around the 110 mark, they said that's probably going to be good to, start riding a bike a little bit. Other than that, just normal life goes on as normal. There's no restrictions that I have. I will say some, especially without the brace, some steps that I have even now, I'm like, oh, that was like a weak step. Like my leg kind of felt like a little like give in it. So that's still happening, which I've heard is totally normal. So I'm not that concerned about that. There are some days where I feel really good, where I don't even kind of in my mind, I don't even think I have a knee injury or I'm coming back from something so big, and I have to like kind of remind myself almost, okay, take a step back. I like the other day I almost like jumped on accident, like total on accident. I almost just jumped like in a moment of I don't even know, happiness or whatever, and I was like, oh shoot, I almost jumped. Like that would have been I mean, probably wouldn't have been, nothing bad would have happened, but it would have been interesting to say the least. I just didn't even realize that I had an injured leg. So things are going well. I'll check back in, when I have some more progress to report, I guess. But for now, I'm just continuing to hustle my rehab, do all my exercises, eat well still, go to the gym, and control the things that I can control. You can only control so much. So I'll check back in soon.